Hello and welcome to another episode of Ask a Nac Doc. I'm Jeff Patterson, Chief Executive Officer for Nacogdoches Medical Center. Today I'm here with Dr. Rachel Head, urologist.
Howdy.
Thank you so much for being here today. Being from Nacogdoches, I just would like to ask you to share some about you and your family.
Sure. So I was born and raised in Nacogdoches, so it was very cool that I got to come back about 10 years ago. Drug my husband all the way from South Carolina and have turned him into quite the Texan and Nacogdoches citizen, I would say. He's a pediatrician here in town, Ryan Head. We have 3 little boys that are in 3rd grade, 1st grade, and 4-year-old class, if you will. So we enjoy being close to my family and my sister, and it's super fun to take care of church friends and family and people that I knew growing up, and get to come back to the community that I love.
Well, we sincerely appreciate you having on our medical staff and being our urologist. I think one topic that comes up a lot, especially with men, is prostate health. Do you have any tips for us, or do you have anything you can share with us about prostate health?
Sure. So a lot of people ask me, well, what is the prostate? So the prostate is a gland that sits below the bladder. Men urinate through the middle of it. It's like a donut. And so the older you get, the bigger it gets. Just like your nose and your ears keep growing, you can expect your prostate to keep growing. So all men will eventually need to see a urologist, most likely. The reason that I see a lot of men for prostate issues is when they start to notice that their stream when they urinate becomes smaller, or they have to push to get started, starting and stopping, getting up at night more to urinate, that sort of thing. Those could be signs that the bladder muscle is having to squeeze harder and harder to get past that prostate. So it is important to pay attention to signs of those sort of urinary symptoms and seek help.
So as a board certified urologist, what are some treatments that you can provide for some of your patients?
First, I think it's a great idea to address this with your primary care provider who has access to medicines like Flomax. There's a medicine that shrinks the prostate that works really well in combination. But ultimately, those type of medicines work in about 60% of men. There are some things like going down on caffeine, maybe not drinking a whole lot of water or Coke or tea right before bedtime, some behavioral modifications. But we generally start with medicines, and if medicines don't work, there's a workup I do in clinic with looking in the bladder, in clinic with a camera, getting an idea how big the prostate is, because there are multiple surgical options to help people urinate better. I'm just a plumber, so I'm a really good plumber, and I have lots of tricks up my sleeve.
Yes, ma'am. Well, thank you for sharing that with us today, and thank you for joining us for another episode of Ask a Nac Doc.